This is my 36th year on the committee, on the healthcare committee, so it's been a long time trying to get to this point where we actually have a plan to deal with the long-term healthcare problems of our country. And amongst those includes the National Alzheimer's Project Act to deal with this very important issue that cost the federal government, Medicare and Medicaid last year spent $130 billion on Alzheimer's patients in America. Unbelievable amount of money. And that's with only 5 million Americans having it. By the time all the baby boomers have retired, the cost is going up to maybe $600 billion a year just on Alzheimer's patients if we don't find a cure for it. And it's obviously a budgetary crisis that is looming. And last week, Madam Secretary, we thank you. You issued your draft national plan pursuant to the National Alzheimer's Project Act, which I'm the principal House author of, along with Congressman Smith. And I think it's great. You know, and the one thing I wanted to talk about here today is that at NIH, there's $6 billion a year spent on cancer research, and there's $3 billion a year spent on AIDS research, but only $489 million on Alzheimer's, even though 15 million baby boomers are going to have it. We have to find the cure. And so, Madam Secretary, I congratulate you and the administration on announcing the addition of $80 million more in this coming year's budget on the research for Alzheimer's. I think that that is absolutely critical, and I congratulate you on that. And I just think it has to be dramatically higher. And if there's one thing we should just signal out and just say, this has to be spared, it's the NIH budget. That just has to go up and up and up, because the National Institutes of Health are really the National Institutes of Hope. And in Alzheimer's, there's really going to be a medical catastrophe that hits this country when all the diseases that we've been successful in helping to cure lead to people living so long that half our population winds up in retirement with Alzheimer's. It's going to be an absolute disaster, and it's going to cost us a fortune. And the second thing, Madam Secretary, is in the Affordable Care Act, I was able to include language for an Independence at Home pilot project. And there are now more than 3 times as many applicants, that is, medical institutions that are applying for those slots in order to conduct this experiment. And I'd just like to draw to your attention the fact that the VA has already had a wildly successful program that had 11,000 people in it, that reduced hospital stays by 60% and nursing care days by 80%. And so I appreciate all of your efforts in this area, but I think it could help us to telescope the time frame that it's going to take us in order to put together a program to keep people at home, share it with the institutions that are working hard in partnership to keep them at home, making the patients and their families better able to deal with the disease. So I'm just looking for a little wisdom from you in terms of what what your agency is doing, and how much of an imperative you see this for our country.
Well, first of all, Mr. Markey, I want to thank you for your tenacious leadership on the Alzheimer's issue, and continuing to raise it and make sure it's an issue that's focused on. As you know, not only is there 80 million new research dollars in the 2013 budget, there were also reallocated another 50 million in the 2012 budget at NIH. So it's about a 25% increase in Alzheimer's research. We also have proposed a portion of those funds, additional funds, not those funds, for caregiving and at-home care, because we know family care providers are the largest number of providers for family members. But I would share your interest, and we look forward to working with you on what is the long-term strategy, how fast we can get there. As you know, some timetables were set for the first time in the National Alzheimer's Plan. There's a lot of agreement that we probably need to move ahead of that pace, but at least we have a pace and a measurable pace outlined. And so we would look forward to working on getting the resources, getting the research, getting the caregiving strategies in place.
A fully implemented Independence at Home project could save billions of dollars a year if we could just get to the point where we verify what the VA has already determined exists.
Well, that's a great point, and we will definitely work with our partners at the VA too.
Thank
Chair,
you.
thanks,
Thank you,
gentlemen.
thank you for your great work. Appreciate it.
Chair, thanks.